Back with the Rocket Right Show. I'm Dr. Kayla in the house with Hurricane Betsy Barnes, and I'm so glad that we have two docs from Ochsner Medical Center here in Baton Rouge with us, Dr. Aldo Russo and Dr. Kayla Sliman. Thank y'all for joining us.
Thank you for having us.
So, both gastroenterologists, and Dr. Russo, you're the regional medical director here, and you're the section head. And we were just talking a little bit, but the girls are outnumbering the guys over there in the gastroenterology department, right?
Yes.
It's kind of the same thing like with OBGYN, which was my specialty, that we started outnumbering the guys a long time ago.
Yeah, we have the fortune to employ or hire 5 female gastroenterologists, and we also have 4 nurse practitioners that are females as well.
Yeah, well, coming as an OBGYN, and I know we're going to talk about colonoscopy and screening, which is something every woman hated when I brought that up to her. But they always want to see a female physician, and so I think even a referral to the gastroenterology, it's a little easier to twist their arm to get the test that they need. So
it is.
You see that too?
Absolutely. Yeah. They just feel a little more comfortable talking to a woman.
Yeah. So I want y'all to, before we get into the discussion, tell folks a little bit about your background, like where are you from, where did you train, and how long you been here?
So I've been in Baton Rouge for 16 years now. Mm-hmm. So I trained at LSU.
Got it.
But I'm originally from Dominican Republic, so I'm been in the country for 27 years, 28 years.
Mm-hmm. So. That's a while. So you liking the Cajun food down here?
Yeah, I'm not leaving, and I'm married a Louisiana girl.
So she's not going to let you leave or go anywhere else.
Okay, that's it.
You marry somebody from here, chances are you're not leaving.
Right.
That's for sure.
Yeah. So, Dr. Sliman, how about you?
I was born and raised in New Iberia, Louisiana.
Okay.
And then went to LSU Medical School in New Orleans, and then left the state for 6 years for my training. I trained at Georgetown in Washington, D.C., and then moved on to Texas to finish up my training in gastroenterology, and decided it was time to come back home.
And your family was really excited about that, weren't they?
Very excited for me to come
And our show plays in New Iberia, so they're going to get to see you.
Wonderful. Good.
Yeah.
See you and hear you.
Wonderful.
They're like, and we just thought you were a doctor, and now you're a TV star too. That's what they're going to say. So let's talk a little bit about screening. I know that it was really tough during COVID. So many people didn't get any of their screenings. Women, you couldn't even go in for your appointment, so women weren't getting their mammograms, they weren't getting their annual checkup, which is frequently the doctor who's saying you need to get your colonoscopy too. Are y'all starting to see folks come back and think about, I need to get back into my appropriate screening, and are you starting to see that kind of volume come back in?
Yeah, we are actually. Of course, for a while there was the hold on doing these kind of procedures for safety reasons, and then it was slow initially coming back. Patients were a little reluctant for obvious reasons, but in the last several months we've seen an increase, and we've been very busy with the basic screening colonoscopies. People catching up from 2020.
Right, because they were like, oh my goodness, my 10-year was up 2 years ago probably by the time, the whole 2020 just disappeared, and they might have been thinking about it, and now, they're like, I'm 2 years late now, so that's a good thing. And then let's talk a little bit about, those screening guidelines changed a little bit. Yeah. So, it's still a tough call to get some of those women and men. They're just as much, they're kind of probably more babies than women about taking care of themselves, but twisting their arm to say, yes, you really need to get that screening colonoscopy. And a lot of people still have in their head that it's 50, but those new guidelines, and they might need to think about it before then. Talk a little bit about that.
Yeah, so the guidelines have changed, and now most societies recommend getting screening at 45. We've seen an increase in the incidence of colon cancer in patients under the age of 50, and so through enough studies have shown that by starting the screening earlier, we're able to catch more. And an interesting statistic is that if by screening starting at age 45, we could prevent up to 60 per 1,000 patients colon cancer, and
That's
prevent
huge.
it's huge
That's
and
really
prevent
huge.
28 per 1,000 deaths from colon cancer.
Yeah, and that's
28 per
amazing. And so for
1,000.
those people who are going, I don't want to drink the stuff. Oh, the thought of that, I just can't do that. If you look at those statistics and you know, I could be that person that was prevented because I went in and had that screening.
They could live
That is
decades
so
longer.
much easier than having to go through treatment.
Sure.
Yeah.
Absolutely. I think that if you look at the alternative of not doing it and then getting colon cancer, the prep is nothing. The
Absolutely.
prep is absolutely just a little bit of discomfort for a few hours because you have to be going to the bathroom a lot, but after that it's over.
Absolutely. And then you don't even know you had the procedure.
Correct.
You know,
That's
right.
you just have to make sure you don't say anything stupid during that time, right?
Correct.
Just don't take a friend with you that would record you
Yeah.
while you're coming out of
That's right, because we don't tell. We don't tell what's said in endoscopy.
So, speaking of that, do you have people when they're coming in for their consultation about screening? Do you have them asking? So I've heard there's some alternatives. Like I can just check my poop at home and send that in, or I can do this other. It's less invasive. Let's talk about the downsides of those things. Because it doesn't take the place of the colonoscopy.
It doesn't. The colonoscopy is the gold standard, and the reason is that it's not only that we can catch colon cancer, but even more importantly, we find pre-cancer cells, and those are
Yes.
polyps. And if we find those polyps, they're not cancer. And I tell everyone every day, it's not cancer, but it can grow into cancer, and that's how
Right.
colon cancer starts. So with the colonoscopy, we take it out, so we eliminate that risk, that piece of it completely. These other tests are good, and there's a role for them, particularly for people who have reasons that they can't get a colonoscopy
Right.
done or feel they shouldn't get a colonoscopy done.
But it's not going to pick up those precancerous lesions.
Exactly.
It is going to diagnose a colon cancer. Or it could be some other thing. So I don't want to say it's going to diagnose.
Sure.
It's going to. There might be blood. There might be reason for further evaluation. There might be something that shows up, but it's not going to show those precancerous polyps more than likely.
Exactly. There is a role for them, however. If it is positive, it does lead to a colonoscopy. But we certainly advocate getting that done over nothing. And so, for some people, it is challenging to get the colonoscopy done, and these tests would be a perfect place for that.
Right. And that's the thing that they need to just, don't be afraid and not talk to your doctor about them and not just get it done, because that's what people do. Talk to them about your concerns and whether something is better than nothing. I did look at the links, because you can go to ochsner.org/doctors, put in your names, and read all about you. But also you have some nice blogs. A lot of things that people have questions about, and some of that is your gut health and some things that you can do personally to reduce your risk of getting colon cancer. Do you want to speak to that?
Sure. We know that diet and physical activity plays a significant role in the development or the prevention of colon cancer. So a plant-based diet and also moving your body at least 30 minutes a day, 4 days a week, 4 or 5 days a week, decreases your chances of getting colon cancer for sure.
And so if you can be doing those things,
But it could also be that you're ruling out some different things. Like it could be stomach or intestinal or something else, and somebody's just not feeling right, or they think it's spicy food, or they think it's something else, but it's really not that. It's just presenting. And that's where a lot of people, I just have indigestion. It might not be indigestion at all.
Sure.
It just might be hitting you at the same time you
Correct.
ate some of the wrong foods, or ate onions or something else that didn't used to bother you.
well, there are a lot of benign, we were talking about screening for colon cancer, but there are a lot of benign gastroenterology issues that plague people. And
Correct.
so do y'all each have any special area of interest in gastroenterology?
I do. I primarily see patients with inflammatory bowel disease, so things like Crohn's and ulcerative colitis.
Right.
And then I have a special interest in lifestyle and alternative medicine, and so treating some of the more functional, we call them functional diseases of the gut, so irritable bowel, and how we incorporate those lifestyle changes, the dietary changes to treat without using medicine.
Right.
Yeah, and my interests are kind of the same, but also I try to focus on liver diseases and more of a general GI like acid reflux and things like that.
Those things
Well-
are really needed. People need to talk about that. So I'm glad
Absolutely.
you came to talk about that now.
Yeah, yes.
Because it could save somebody's life. 28 out of 1,000 people.
Yeah.
Correct.
It
Yeah,
really could.
absolutely.
Yeah, well, we have been talking with Dr. Aldo Russo and Dr. Kayla Sliman from Ochsner Medical Group in Baton Rouge. You can look them up at ochsner.org. We'll have that information on our website, and we'll have to have y'all back to talk about some other GI issues because there's a lot of them out there that plague folks, and especially women.
And maybe
So-
just some of the other things that Ochsner's offering.
Absolutely.
So we'd love to have you come back.
We can spend the whole show.
Okay, well, you got it. You got it. Next time we'll just have a whole show with you. Thank you
Thank
for
you.
being with
Thank
us.
you for having
And up
us.
next,
Having us.
we're going to talk about some great food with City Port Catering.